What if I told you that some health checkups, the very ones many people rush to schedule every year, could actually do more harm than good once you're over 70? It sounds strange, doesn't it? After all, we've spent most of our lives hearing the same message. The more tests you do, the safer you are. Catch problems early, check everything, scan everything, test everything. But what many seniors are now discovering is that not every medical test is always helpful, especially later in life. In fact, some screenings can lead to unnecessary stress, risky procedures, and treatments that might never have been needed in the first place. Today, we're going to talk about 5 health checkups that many experts say seniors over 70 should think very carefully about before doing. This doesn't mean you should ignore your health. Not at all. Regular care and communication with your doctor are incredibly important. But it does mean that sometimes the best decision is not automatically saying yes to every test. Medicine is changing, and researchers are learning that more testing doesn't always mean better health. If you or someone you love is in their 70s or beyond, this conversation could help you avoid unnecessary risks and focus instead on the checkups that truly protect your quality of life. Let's start with something that surprises a lot of people. Many seniors continue getting routine full-body scans or advanced imaging tests even when they feel completely fine. These scans might include CT scans, MRIs, or other high-tech imaging tools used to look for hidden problems. Now these technologies are incredibly powerful when they are used for the right reasons. If someone has symptoms that need investigation, imaging can be life-saving. But when these scans are done routinely without symptoms, they can open the door to what doctors call the cascade effect. Here's what that means. A scan might detect a tiny abnormality that may never have caused any harm in your lifetime. Maybe it's a small spot, a harmless cyst, or a very slow-growing change that your body would have handled naturally. But once it's found, doctors often feel obligated to investigate further. That leads to more scans, biopsies, or procedures. Each step brings its own risks, anxiety, and sometimes complications. Studies have shown that many of these incidental findings never turn into serious health issues. Yet the process of chasing them down can create unnecessary stress and even expose seniors to radiation or invasive procedures that carry their own dangers. Another test many seniors are surprised to hear about is certain cancer screenings that continue far beyond the age where they provide clear benefits. For example, some people continue routine screenings for cancers even into their late 70s or 80s without discussing whether the test is still helpful for them personally. Take prostate cancer screening, for instance. For younger men with long life expectancy, screening may help identify aggressive cancers early. But prostate cancer often grows very slowly. Many older men may live for decades without that cancer ever affecting their lives. When screening continues too aggressively in older age, it can lead to biopsies, treatments, and surgeries that cause side effects like incontinence or sexual dysfunction, even when the cancer itself might never have caused problems. This is why many medical organizations now recommend that prostate cancer screening be individualized after a certain age rather than automatically continued for everyone. The same type of discussion applies to other cancer screenings as well. Mammograms, colon screenings, and other tests can be extremely valuable earlier in life. But as people age, the balance between benefits and risks can change. For someone with serious health conditions or limited life expectancy, the potential harms of testing may outweigh the benefits of finding a slow-growing disease. And that brings us to an important idea that more doctors are emphasizing today. Healthcare should focus on quality of life, not just the number of tests performed. Now let's talk about something many seniors experience every year without questioning it: annual stress tests for the heart. Stress tests can be very useful when someone has symptoms like chest pain, shortness of breath, or suspected heart disease. They help doctors understand how well the heart functions during physical activity. But when stress tests are done routinely on people without symptoms, they can sometimes produce false alarms. A stress test might show a possible abnormality that leads to further testing, such as angiograms or invasive procedures. Yet in many cases, those abnormalities turn out to be minor or unrelated to real disease. For seniors, invasive heart procedures carry real risks, including bleeding, complications, or recovery challenges. Experts increasingly recommend that heart stress tests be guided by symptoms and individual risk rather than performed automatically every year for people who feel healthy. Another test worth discussing is bone density scanning done too frequently. Bone density tests are important for detecting osteoporosis, which can increase the risk of fractures. But once someone has already been evaluated and is being managed appropriately, repeating the scan every year often provides very little new information. Bone density typically changes slowly, and repeating scans too often can create unnecessary costs and worry without improving treatment decisions. Many guidelines suggest that these scans can often be spaced several years apart, depending on the individual situation. Now let's talk about something that affects almost every senior: extensive blood testing panels done routinely without clear reasons. Blood tests are valuable tools, but doing very large panels frequently can sometimes lead to confusing results. The human body is complex, and lab values naturally fluctuate slightly from time to time. A number that falls slightly outside the normal range may not actually indicate a real problem. But once an abnormal result appears, it often leads to more testing. Additional blood work, imaging, or specialist visits may follow. For older adults, this cycle can create anxiety and sometimes unnecessary treatment for conditions that might never have caused harm. Doctors today are increasingly recommending a more targeted approach to blood testing, focusing on the tests that are most relevant to a person's health conditions and symptoms rather than ordering massive panels automatically. Another area where seniors should have thoughtful conversations with their doctors involves colon cancer screening beyond a certain age. Colonoscopy is an important tool for detecting colon cancer earlier in life. But the procedure involves sedation and carries small risks such as bleeding or intestinal injury. For seniors who have had normal screenings in the past and who have reached their mid to late 70s, continuing colonoscopy may not always be necessary. Some guidelines suggest that after a certain age, the benefits may decrease while the risks increase. Of course, this decision should always be individualized, especially if someone has symptoms or a strong family history. Now, hearing all of this might make some people nervous. You might be thinking, should I stop doing checkups altogether? And the answer is absolutely not. The goal here is not to avoid medical care. The goal is to make sure that the care you receive truly benefits your health and well-being. Some checkups remain extremely important as we age. Monitoring blood pressure, managing diabetes if present, reviewing medications regularly, checking vision and hearing, staying up to date with vaccines, and maintaining mobility and balance are all incredibly valuable for seniors. In fact, some of the most powerful things you can do for your health after 70 have nothing to do with complex medical tests. Daily movement keeps muscles strong and supports heart health. Even gentle activities like walking, stretching, or light strength exercises can make a huge difference in maintaining independence. Nutrition also plays a major role. Eating balanced meals with plenty of vegetables, healthy fats, lean proteins, and fiber supports the body's natural repair systems. Sleep is another powerful health tool. Many seniors underestimate how important good sleep is for brain health, immune function, and emotional well-being. Social connection may be just as important. Studies repeatedly show that seniors who stay socially engaged tend to live longer and experience better mental health than those who become isolated. And one of the most important habits of all is open communication with your doctor. Instead of simply agreeing to every test automatically, ask questions. Ask what the test is looking for. Ask how the results might change your treatment. Ask about potential risks. These conversations help ensure that every decision is made with your personal health goals in mind. Healthcare is moving toward a more personalized approach, especially for seniors. What makes sense for one person may not make sense for another. Two people of the same age can have completely different health situations, lifestyles, and priorities. Some seniors are incredibly active well into their 80s and 90s. Others may be managing several medical conditions that require careful balance in their care. The key is making thoughtful decisions that match your own health journey. It's also important to remember that fear should never drive medical decisions. Many people agree to extra tests simply because they're afraid of missing something. But sometimes that fear leads to unnecessary procedures that create more harm than protection. The truth is, modern medicine is learning an important lesson. Sometimes less is more. Choosing the right tests at the right time is far more valuable than simply doing more tests. Your body has carried you through decades of life experiences, challenges, and victories. Taking care of it now means focusing on what truly helps you stay strong, active, and comfortable in the years ahead. That might mean prioritizing movement, maintaining good nutrition, protecting your sleep, managing stress, and building meaningful connections with the people around you. Medical care should support those goals, not overwhelm them. And the best healthcare decisions are the ones made together with trusted medical professionals who understand your personal history and priorities. So the next time someone suggests a test or screening, pause for a moment and ask a simple question. Is this test truly likely to improve my health or my quality of life? If the answer is yes, then it's worth considering. If the answer is uncertain, that's the moment for a deeper conversation. Because after 70, good health isn't just about finding every possible abnormality in the body. It's about living well, staying active, and protecting the independence and joy that make life meaningful. Your health journey is unique, and every decision should support the life you want to live. If you found this helpful, share it with someone who might benefit from understanding these important ideas. The more people know about making thoughtful healthcare choices, the better we can all support healthy aging together.